Hi, my name is Shannon. With regards to Module 3 blog, in regards to leadership skills, one of the questions that is asked of us is with regards to Chapter 7 and as far as the leadership skills, as well as the quiz that we did or questionnaire that we did, what we found as far as what would be most beneficial as far as skill set perhaps in obtaining resources such as for staffing. Whenever I took the quiz or questionnaire, actually all three were equal, 27 points per se with each of the three sections. And those three sections were, of course, administrative, interpersonal, and conceptual. That, for me, tells me that I guess I would consider myself, and I do consider myself, more of a well-rounded person, more well-rounded as far as management and looking at all the components. Now, as far as the skill set or the different things like the controlling, the coordinating, and all of those sorts of things, to be honest with you, I feel that they are all important, and some of them kind of fall underneath the umbrella of others. But for example, like the coordinating, of course, that's important to be able to do, to coordinate anything that you're doing, to coordinate the care, to coordinate staffing, to make sure that you're being proactive as opposed to reactive, directing as far as being able to facilitate, being able to supervise, delegate, and get the jobs done. As far as like controlling, I think that that's kind of essential to get things done and take care of things that you need to get done. Planning and staffing, of course, kind of go hand in hand. Again, being able to be proactive as opposed to reactive. I'm a firm believer in that. Being the ability to be able to think ahead, the ability to constantly, for me, I'm constantly always thinking, well, what if, and that way we can kind of get a game plan as far as facilitating and as far as getting everything together. I mean, we have staffing issues as well. I don't work in a hospital setting. I do work in home health, but we have patients that have to be seen every day. So if someone were to call out, someone were to quit, or several someones, or vacation, you kind of have to think ahead. You really do, because if not, it cripples not only your organization, it cripples your staff, it cripples ultimately the patients are the ones that pay for it. So with that being said, I feel like all of the components really are actually very equally as important. And again, some of them kind of fall under each other, but I think that the controlling, the coordinating, the directing, and planning, staffing, organizing, management, the whole thing, I think that it's all very important. And all those pieces they work together. Ultimately, I mean, if you really want to think about it that way, they ultimately do work together, because ultimately one key kind of fits the other. So if you, as a manager, realize that we're not probably all good at everything, but I think that you have to be a well-rounded person and be able to think outside of the box to get whatever it is that needs to be done accomplished. So with that being said, I think all of those pieces are important. And really, as far as management, that term, everything else really falls underneath it. The ability to listen, the ability to think ahead, the ability to ask, the ability to work with, the ability to do really any and everything falls under that whole management title. So in order to be successful, I think that you have to be able to open your mind and actually think about those other components and how they kind of affect each other. They affect the clinicians, they affect the patient care, they affect the other managers, they affect really absolutely everything. With that being said, as far as to identify the departments, I'm at this point, I am in a management position. I am a manager of clinical practice and also quality assurance. I have held other positions. I've held the position above me as far as director and so on and so forth. And with all of those pieces, I guess you can add or subtract what groups you would need help with. So, for example, as a manager of clinical practice or quality assurance manager, of course that's beneath the director, but we really need the assistance from groups of people such as referral sources, doctors' offices. We have to be able to have the appropriate information and history and so on and so forth from the doctor's offices, the hospitals, the clinics, whatever the case may be, so that we can provide the best care for the patient. With that also being said, we also have to work with the sales team. With the sales team, they're the ones ultimately responsible for obtaining those referrals. Our intake department, who deals with the insurance. So while it is the business of taking care of patients, it is also a business in which we have to make sure all of those pieces are there. The clinicians that are out in the field, I mean, they're just as big of a piece of the puzzle as anyone. Without them, we would not be able to care for our patients and provide the services that we need to be able to provide for the patients and the proper care that we need to be able to. If I were in the director position, which I have been in the past, I am not currently with this company, but with that being said, also I would need to elicit or obtain the help from area people, from human resources, from recruiting, because it kind of, it all just works together, because it's really from the top down, you really need, everyone plays an integral part in the management, in leadership, in appropriate leadership skills. And with that being said, you all need each other. So while the position that I am in, yes, it is actually always considered the backbone of home health. That is all true, because we're kind of the middle as far as the management of the field clinicians that are seeing our patients, whether it be physical therapists, occupational therapists, nurses, RNs, LPNs, CODAs, PTAs, social workers, speech therapists, home health aides, whatever the case may be. So we have to help them, but they also help us. And then above would be, of course, the director position, and then the area director and area director of operations, of sales, intake, our doctors, so on and so forth. So it all really plays key in everything. It really takes, it's kind of like raising children, really. It takes a whole village. In many instances. And I don't think that a lot of times we think about it that way when we are maybe in a hospital, because so many times I don't think we're thinking about a lot of those other pieces necessarily. We're thinking about just the patient care, and absolutely that should be the primary focus. But having the opportunity to be in the position that I am in, it's easier to see how all the pieces work together, and they're all really equally as important, because ultimately in the end it's the patient that will either receive bad or good services and appropriate services. So with that said, we definitely want to always provide the best services, the safest services for our patients. As far as preference and structure or structure at my work, I am in my opinion, it is more of a vertical as opposed to horizontal, because within the company, to me, it's more of a hierarchy, more of a upward, um, you know, kind of situation, whereas it's a little different in the hospital setting where you have a lot of people at this level. They might do different jobs, but as described, in reading, it's a lot of people at the same level trying to provide the same type of care, whereas in home health, it's just really here, 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 here. So you have your clinical staff, then you have your, what I would be, manager of clinical practice, then above that, director, then above that, so on and so forth. More of, to me, structured like a chain of command, which I prefer. I know a lot of people prefer more of the horizontal. I prefer more of the chain of command kind of hierarchy, because I think that there's more structure. Not that people don't work together. So it kind of has some of the concepts of the horizontal, but not so much. It is more of the hierarchy kind of scenario, or chain of command, as I like to call it, just from my military background. So perhaps that's why I prefer that model as opposed to the horizontal, because everyone has their place, and although it's kind of like, in other words, I can go out in the field. I do it all the time to assist other clinicians, or if there's a nurse that calls out, or whatever the case may be. So it's not as though we're in those positions and that is the only place we stay, because I feel like as a manager, and as a good manager, you lead by example. So I feel that in order for people to feel comfortable doing more for you, and sometimes, of course, we're all asked to do more than what we normally would. But I feel like if you have people that don't forget where they necessarily came from, or what it's like, because we hear it all the time that, oh, you're in the office, you don't understand us. But I absolutely do, because I worked in the field for many years. And so to me, that's also important, that when you become a manager of a type of organization specifically, and for example, again, home health, I think it's very important to start from basically, we'll say, the ground up, because you understand where they're coming from, you understand where you're going, you understand the in-betweens a little bit better than someone that just walks in off the streets and really doesn't know what it's like to be in certain positions, certain situations. I just think it's a better way. It's a better way of being put in those positions. I think it gives you just a much better idea of what your employees are dealing with, as opposed to what you read or what you've heard or anything like that. As far as I call it interdisciplinary. I know that there are different contemporary terms that people call it, but as far as that goes, they term it perhaps interprofessional, or whatever the case may be, but ultimately it's all the same. When it comes down to it, it is simply just that the patients have the ability to get the best care, and the reason is because you don't have just one type of person seeing and giving their input into the care for the patient. For example, for me, we have the whole team. I mean, every discipline under the sun, just about. So we talk to each other, we communicate with each other, and any problems or issues or concerns or things that we may be beating our heads against the wall, because as nurses, we think differently than physical therapists, and we think differently than social workers, or whatever the case may be. I mean, that's just because that's how we were trained. However, working together, like in a situation such as myself, where I am working with my physical therapies and their assistants, my occupational therapists, their assistants, the home health aide or nurse aide, whatever you want to term it, the social worker, the speech therapist, the RNs and the LPNs, kind of all those pieces are working together. And we absolutely do meet together and we do discuss patients. And anytime there's an issue, that communication is there so that we also, of course, work with the doctor's offices and the referral sources and their offices, sometimes even assisted living facilities that we're teaching and that we're working with those facilities as well. So it is for the benefit of the patient, but ultimately it benefits everyone because, we want the patient to have the best outcomes. We don't want the patients to go in and out of the hospital. I mean, ultimately that's a hospital's goal. It doesn't look good there either because it looks like you're not providing the care that a patient needs. When in actuality, I think that we don't take credit for all the care that we do provide because maybe it's just not documented that way. So with all this being said, my article that I read was actually called The Importance of Interprofessional Practice and Education in the Era of Accountable Care. This was written in 2016, and it was written by Jane Nestor. So that's the article that I read, and it's very much so in line with what I was saying, that it really has to do with just a team approach for the best care for the patients. And ultimately, that's what it's about. So with that being said, as long as we have the patient's best, health benefits or actually whole, we're all taught through schools, nursing schools and that sort of thing, that you're there to help the whole patient, not just the disease process, not just that medication, that new medicine that they've ordered, the doctor's ordered, or the 20 doctors have ordered. And you're not there just for the patient. You're also there to help the family as well, because that's what we do. We teach, we educate, and at the end of the day, if we're doing that, then we're doing our job, and doing it with compassion and doing it with concern and all of those other things that we could use to describe the good things that we do. Absolutely, that should be why we are nurses, why we are in this profession. So with all of that said, I think that as a good manager, we definitely have to be well-rounded, and I think that that's just a benefit for ourselves, for our clinicians, for our patients. We have to be able to put ourselves on everyone's level, whether it's the patient, whether it's the caregiver, whether it's the person that's seeing the patient, whether it's someone above you. There's a reason that everyone thinks the way that they do, and it's just ultimately to benefit the patient. So I appreciate this time, and I look forward to the rest of the weeks with the class, and thank you.